Meet Grace. Like many, Grace struggles with weight loss and obesity. It has been affecting the quality of her life because it affects her self-esteem, it creates concern over the future of her health, and it affects her ability to do certain things. Grace went to her primary care provider to seek help in her weight loss journey, and her provider had just the thing to help her, and prescribed Phentermine, a stimulant primarily manufactured by KVK Tech. Phentermine is also known as Adipex P, Lomera, or Suprenza. Phentermine is a U.S. FDA-approved anti-obesity drug approved to be used as a short-term adjunct for the treatment of obesity. For up to 12 weeks, this medication can be added to a weight loss regimen based on exercise, behavioral modification, and calorie restriction for those with a high initial BMI, and for those in the presence of other risk factors such as diabetes, hyperlipidemia, or controlled hypertension. Common side effects of this medication include anxiety, constipation, diarrhea, dry mouth, trouble sleeping, bad taste, decreased libido, sexual dysfunction, and agitation. Do not take Phentermine with monoamine oxidase inhibitors as it increases the risk of a hypertensive crisis. Do not take with insulin and oral hypoglycemics as requirements may be altered. And do not take with adrenergic neuron-blocking drugs as the hypotensive effect may be decreased by Phentermine. Co-administration with other drug products for weight loss is contraindicated as the safety and efficacy of combination therapy has not been established. Do not take with fenfluramine or dexfenfluramine as it has resulted in pulmonary hypertension and cardiac valvular disease in otherwise healthy patients. Do not take if you have a history of cardiovascular diseases such as coronary artery disease, stroke, arrhythmias, congestive heart failure, and uncontrolled hypertension, or have a history of hyperthyroidism, glaucoma, agitated states, drug abuse, or are pregnant or nursing. Phentermine is an oral medication in either a capsule form excluding Lomera with a dose of 15 to 37.5 milligrams and 1 to 2 divided doses taken daily, a tablet form pertaining only to Lomera with a dose of 8 milligrams taken 3 times daily, or an orally disintegrating tablet form with a dose of 15 to 37.5 milligrams taken daily. For pediatric and adolescents above 16 years of age, refer to adult dosing. For geriatric populations, refer to adult dosing, but due to substantial renal excretion, use with caution. Avoid late evening administration. It is most effective when combined with a low-calorie diet and behavior modification counseling. Depending on the type of Phentermine prescribed by your provider, it should be taken 30 minutes to 2 hours before breakfast. Phentermine is not approved for long-term use as it has a high abuse potential and prolonged use may lead to dependency. Tolerance usually develops within a few weeks and should be discontinued when developed. Weight loss guidelines, risks, and benefits should be examined with your provider before taking Phentermine to see if it's right for you and your weight loss journey.
Created using Powtoon.